structure that are present here in our EOC, and our structure is flexible and adaptable, and that's certainly what we've been doing in recent weeks here as we've assisted the community through this effort. A couple key principles that I want to focus on is that our EOC structure lets us have unity of effort in what we are focusing on. So everyone reports to one other person, and we make sure we don't have any information that gets lost in translation. We've implemented a single point ordering system, which I'll talk a little bit more about here later in the presentation. And then we have joint public information, which means that in terms of anything that we're releasing to the public, it's all coordinated through our Joint Information Center, and that allows us to have a clear and consistent unified message out to the community. The timeline of our response efforts and really our preparedness actions have been a continuous process. So our emergency operations plan is a living document. It's all hazards in nature, so it prepares us to deal with any hazard we might face. Certainly, we are more used to activations that are a couple days long for something like a winter storm or a tropical weather system or a damaging wind event. We're going on week 8 now of this response operation, so certainly is one of the longer operations in my career, and I think probably the longest emergency event that the county has been through. But it has been a continuous process that led up into us sending our initial public information out in January. The county executive directed some activation of part of the process in early March with a policy group to inform him and his senior leadership. We then virtually activated our Emergency Operations Center on March 8th. The next day, activated the Joint Information Center and Government Liaison Officer. And then as the situation deteriorated, Virginia declared a national emergency. The president declared a national emergency. Our EOC was fully activated with the county executive declaring a local emergency on March 16th, and then the state health commissioner declaring a public health emergency on March 17th. So we've really been in a very similar operational stance since that mid-March timeframe when we fully activated. The team here in the EOC and really the whole community and the whole government effort have been working around the clock, communicating 7 days a week, typically meeting multiple days a week. We've always got at least one person on call after hours, if not multiple folks up doing work late to make sure the community's needs are being met. Some recent EOC planning efforts I'd like to touch on that we've had lots of great success with in coordinating. The first and foremost has been supporting our partners in the Prince William Health District, which is ESF 8, and you'll see throughout the presentation, ESF stands for Emergency Support Function. So that is that functional approach to our EOC that I was trying to show with the breadth of that org chart there at the beginning. So we've been focused on the healthcare community and supporting their needs. They truly are on the front lines in terms of our first responders as first receivers, going out to folks' homes and businesses as they might have a medical issue, and then transporting them to a hospital for definitive care, and also some of our healthcare professionals and workers that are in long-term care communities and other settings which are particularly vulnerable. So we've been supporting the health district with any needs that those folks may have when it comes to personal protective equipment, information coordination, etc. We have worked through the process with our state counterparts to send letters to FEMA for approvals on hotel accommodations for persons experiencing homelessness under an order of isolation or quarantine, or for those who are homeless that might be a bit more medically vulnerable. And I'll let Ms. Tierney expand more on that during her remarks. And then that same approval process now has also been extended to first responders and healthcare workers. So if we have a member of our county or volunteer staff in the fire rescue system or law enforcement officers that have been exposed to COVID and for whatever reason don't feel safe going home, if they've got a family member that's medically fragile or something like that, we're also able to accommodate them in a hotel so that they are able to not bring that home to their family. Another great success story, as Supervisor Boddye mentioned, is the Prince William Area Disaster Fund. Really excited to see the effort that came together on that fund. We certainly get support from a lot of the large national focused charities here in the community, but this fund truly is community focused, and 100% of the funds raised go back directly to needs here in our greater Prince William area. So we've been very excited to see that come to fruition. I mentioned briefly the single point ordering process in our Emergency Operations Center. We had it on the books and had done some testing of it, and it was really meant to address several weeks of a need for recovery from something like a hurricane or an extended winter storm of power outages. And I'm very pleased to report that we've successfully adapted that process. It's been operating, of course, 8 weeks now, and we're planning well through the rest of the year as needed, focusing on personal protective equipment and disinfecting supplies. So that's been another great success for us. And then the highlight, I think, certainly also would be the Community Feeding Task Force. So Supervisor Boddye mentioned the community kitchen there in Occoquan is part of that task force. It's one of the sites that works through our hub and spoke model to receive some of the bulk food donations that the task force gets in from food service providers. I believe we're up to 43 different partners now between the spokes and then the additional partners that are receiving commodities from the spokes. And they've done well over 200,000 pounds of food donated out. So again, very happy to see the process with all of our community partners and our partners in the cities of Manassas and Manassas Park that were able to come together with the county and make this work for everybody. So as of 10 a.m. yesterday, and had hoped to have today's data, but the state had a bit of an issue with their reporting system, so we don't have state data yet today. So as of yesterday, statewide, there were 20,256 cases of COVID confirmed by a laboratory in the Commonwealth of Virginia. In the county, we're currently sitting at 2,223 cases, of which there have been 225 hospitalizations, and unfortunately 33 of our community members that have passed away as a result of the virus. In Northern Virginia, there's just under 11,000 cases, and in the National Capital Region, there's almost 32,000 cases. So by comparison, there's 20,000 or so cases statewide and almost 32,000 in the NCR, which is why it's important for us to be coordinating with our colleagues and partners in the District of Maryland. And I know that the governors and the mayor of DC are coordinating to that effect. And our chief administrative officers here in the region are also coordinating efforts to make sure that we're all unified in our processes and procedures for slowly trying to reopen certain services that were not deemed essential so that we don't do too much too quickly. Looking ahead to some of the active planning efforts that we're still undertaking here in the EOC as we look towards the recovery phase of this incident. We are still supporting the feeding task force, looking at a little bit larger of a facility to serve operations for several additional months. We have also, at the request of our health director, Dr. Ansher, worked with them to initiate a community testing task force. One of the important functions of the reopening process is going to be the ability for an increased amount of testing in the community, as well as contact tracing by the health district to address any small pockets of issues or exposures that might occur. So we're supporting the health district with their request for that task force. Our economic development team has stood up a business recovery task force to serve as a clearinghouse for resources that are available to the business community. And they've also been working to aggregate information about the various recovery programs that individual business owners may be able to apply for. We have stood up a election support task force here in the EOC to support the general registrar with any needs they may have for the upcoming town and primary elections. Some examples would be that our buildings and grounds teams have been constructing some plexiglass shields for the various stations and counters that are going to be in each of the precincts. And then the EOC, through our logistics section, is making sure that we've got enough protective equipment, gloves, face coverings, etc., for the team that's going to be working in each of those precincts. Specific to our Emergency Operations Center, some of the novel things that we have stood up to adapt to the nature of this being a pandemic and a little bit outside the box of just a couple weeks long activation. First and foremost, a disinfecting task force. So we've got plenty of supplies on hand, and we've been fortunate to receive some additional specialized equipment that's more effective at rapidly disinfecting larger areas or areas where there's a higher risk of there having been an exposure, like the back of an EMS transport unit, for example. So we've stood a group up that specifically looks at needs for more detailed disinfecting of areas in county facilities or vehicles. We have an internal team that is meeting, taking a look at our county operations and giving recommendations to the county executive and leadership about which functions might be reopened first and what the health district would indicate we need to be doing in terms of community testing capacity, contact tracing capacity, and measures both from the health district and then from any orders that come from the governor. And then finally, we've been working inside the EOC with our finance section to track all the different recovery grants that might be available to the county to help us offset some of our expenses we've incurred with the response to the pandemic. Supervisor Boddye mentioned the majority of these resources already, but just one last item to note. If anyone is interested in signing up for updates on county operations, there's two different keywords. You can text COVID PWC to 888-777 for English, or COVID PWC ES to that same number, 888-777 for Spanish. And with that, that's all I have prepared, and we'll be happy to answer any questions.
Thank you, Brian. That's all very helpful. Would you be able to share this slide deck with us after this is over so we can have it, send it to the folks out there?
Yes, absolutely.
Appreciate that. Yeah, we're going to be opening it up to questions now. If you are with us online, you can go ahead and type your questions into the chat, and we will be able to answer them for you. And again, this is just on Brian's section. We will get to Courtney and Lisa here. And I do see that some more folks have joined us, so welcome to those who have joined us since we started. I am not seeing. There we go. We just got a question from Jason, who works in my office. We asked a really good question. Is it possible to report COVID cases by zip code?
Yeah, that's a really good question. We know that some other partners in the National Capital Region have been reporting in that way because we are a Commonwealth and because of the way health information is protected by state law in the Commonwealth. The Virginia Department of Health is the lone resource and authority for reporting case information. So what they put out publicly on their website is the only information we also receive and that we're authorized to share. We have heard that they are looking at some additional ways of sharing more information. So we're hopeful that that may be something that occurs in the future. But it is just important to note that we continue to be in community spread here in Northern Virginia. That is part of the messaging and the reason why the governor elected to extend Executive Order 53 through next Thursday. And then we'll be taking a very slow incremental approach. So social distancing and good hand hygiene and wearing face coverings are still going to be part of our daily life here for a little while. And that's really the most helpful thing that the community can be doing to help us still limit the spread as we edge toward recovery.
Oh, yeah, thank you for that, Brian. Yeah, I know. And that question was actually from Mr. Brian Blankenship. So thank you, Mr. Blankenship, for that question. I know that some folks have been curious about having more drilled down reporting and just wanting to know what parts of the community have been more impacted than others. And for safety reasons, obviously, parts of the community that folks should be sort of keeping a little bit more cautious of and what have you. But obviously, we're all in this together. And as the Northern Virginia Prince William community, we're still obviously dedicated to making sure that everyone gets the help that they need. So let's see. Any other questions for Brian? There's another one here in a second. All right. From Brian Mealy, and I apologize if I mispronounce your last name. Are there needs or opportunities for communications and outreach support for experienced crisis/risk communications professionals for media interview, coaching, or other supports?
Yeah, it's a good question. So we're very fortunate that we've got a great communications team here in the county, and our executives are very supportive of our structure and process. So we have implemented our Joint Information Center very early in the process. Certainly, though, we'd be happy if there's any opportunity to make a connection. So resource COVID-19 offers at pwcgov.org. So Mr. Mealy, if you just want to reach out with your information, I would be happy to at least make the connection with the communications team should they have any unmet needs.
That's a great point. And yeah, I mean, obviously right now, we are obviously going through the process of seeing not only what we're doing right now to help folks make sure people get tested, people get treated, what have you, but obviously as Brian alluded to before, as we get closer to phase 1, as the governor has been calling it next week, obviously we're going to have to outreach to the community even more to make sure folks know that obviously as we get into phase 1, this isn't just completely opening everything up. This is a very deliberate, careful way of being able to get things a little bit closer to normal. So outreach and communications will be very important. So and I know that Brian, your team's definitely on that. So thank you again, Mr. Mealy, for that question. Any other questions for Brian? So if anyone has any other questions for Brian after we wrap up here, please feel free to reach out to my office. We're more than happy to reach out to Brian and his team. I know that sometimes folks might look at this later actually also, because we will be posting this recording online once this is over. So please reach out to our office. And Brian, thank you so much for all that you and your team are doing. I know that our emergency response folks have been working day in and day out. I know that folks, you and your team have not had any sort of break days or sick days or days off. I would imagine you guys haven't been sleeping very much either. But it's a testament to all of you and your team that you've been able to be very effective and very lean in getting us through this crisis thus far. And Mr. Mealy actually just sent a kudos to Brian and his team. So obviously the community is behind you 100%. Thank you again so much, Brian. Appreciate it.
Thank you very much. We appreciate the community support and the board support. It means a lot to the team. So thanks, everybody.
Thank you.